Order. I now call the Standing Committee on Public Accounts to order. My name is Kelly Regan. I'm the MLA for Bedford Basin, and I'm the chair of the committee. Just a reminder to everyone to put your phones on silent. I'm going to ask committee members to introduce themselves, beginning with Mr. Young.
Good morning, everyone. Nolan Young, MLA for Shelburne County.
Mr. Taggart.
Good morning and welcome. Tom Taggart, MLA Colchester North.
Mr. Palmer.
Good morning. Chris Palmer, MLA for Kings West.
Ms. Sheehy-Richard.
Good morning and welcome. Melissa Sheehy-Richard, MLA for Hants West.
Ms. Coombs.
Kendra Coombs, MLA for Cape Breton Centre, Whitney Pier.
Mr. McGuire.
Good morning, everyone. Brendan McGuire, Halifax Atlantic.
I will also note that we have officials from the Auditor General's office, including our Auditor General, the Legislative Council office, Hansard, and the Legislative Committee's office in attendance as well. On today's agenda, we have officials with us from the Department of Labour, Skills and Immigration and the Immigrant Services Association of Nova Scotia with respect to the 2022 report of the Auditor General, Immigration and Population Growth. I will ask witnesses to introduce themselves, beginning with Deputy Czapalay.
Good morning. I'm Ava Czapalay. I'm the Deputy for Labour, Skills and Immigration.
Ms. L'Esperance.
Hello, I'm Jennifer L'Esperance. I'm the Senior Executive Director of Immigration and Population Growth.
And Ms. Watts.
Good morning. I'm Jennifer Watts, CEO of Immigrant Services Association of Nova Scotia.
And I will invite Deputy Czapalay to make her opening remarks. Ms. Czapalay.
Good morning. I'd like to begin by thanking Jennifer Watts for joining Jennifer L'Esperance and myself today with this committee meeting. Settlement is an important part of the work that we do to ensure newcomers can be successful in our communities and our workplaces. Jennifer is a valued partner, and ISANS is recognized throughout the country for excellence in settlement services. I also want to thank the committee for accommodating our travel schedule. Jennifer L'Esperance and I, along with Minister Balser and representatives from the regional enterprise networks, were attending Destination Canada immigration fairs in Paris and Morocco for the past 2 weeks. On November 8th, the Office of the Auditor General released a report on the audit of the Immigration and Population Growth Branch. My thanks to the Office of the Auditor General for reviewing our operations at this critical time of growth in our department. The recommendations on how we can reach program delivery excellence are helpful and will be implemented. People come to Nova Scotia to study, to be reunited with family and friends, to find a safe haven, to start a new life. We're fortunate to play a role in these new beginnings. As many of you know, government is committed to growing our province population to 2 million people by 2060. For the first time, last December, our population reached 1 million people. According to the Statistics Canada population clock, within the past year, that number has grown by another 30,000 people. And this year, we're on track again to have a record number of landings. This year, 10,670 new permanent residents have already been recorded from January to September. That is more than any previous year, and we still have 3 months remaining in the calendar year for processing. It's no secret that the most pressing issue facing our economy right now is labor shortages. Nova Scotia is not alone in feeling the pain of these shortages. It is the work that we do now to grow and diversify our population that will help Nova Scotia's labor market and communities prosper in the future. To be successful, our approach to population growth must be strategic and nimble. We must attract and retain people who are job ready, who have the skills that employers need, and we must make sure that all regions in Nova Scotia benefit from population growth. We must continue to collaborate with employers, municipalities, and a wide array of partners in communities throughout Nova Scotia to support this growth. We know we must strengthen our programs and procedures to continue to meet the needs of newcomers and employers, and the work to implement all of the Auditor General's recommendations has already begun. For example, we have commissioned research on how to better understand settlement funding and how it can best meet the needs of newcomers. We have added more human resources to our Immigration and Population Growth Branch, including 12 new positions to process more applications with consistency. 2 new positions have also been added to conduct fraud investigations and program compliance reviews. And of course, I've mentioned previously to this group that 6 navigators have also been hired to support regional settlement and retention. We are creating new procedures to ensure policies and application assessment tools are updated regularly and effectively communicated to staff. And to supplement the work of our Investigations and Compliance Division, we have added a fraud reporting service. This will allow individuals to safely provide anonymous tips of activity that may be fraudulent. Before closing, I want to acknowledge the areas where the Auditor General's report indicated that we are doing things well. The report shows the department is exceeding our performance indicators. The decisions we're making on immigration applications are the right decisions. And the work that our settlement service providers do is extremely important to the success of newcomers in our province. So thank you again to the Auditor General's team for their thoughtful recommendations that will help strengthen the work in our Immigration and Population Growth Branch. And thanks also to our partners and settlement organizations, including ISANS, who do tremendous work to support newcomers. And finally, I sincerely want to thank the team at Labour Skills and Immigration. They care about their work and they understand that the importance of providing a warm welcome and timely support to newcomers who choose to come here to Nova Scotia. Thank you.
Thank you, Deputy Czapalay. Now, Ms. Watts.
Thank you. Good morning. Thank you for the invitation to speak today at the Public Accounts Committee. ISANS has over 40 years' experience delivering innovative and successful settlement and integration services to immigrants in our province. Our services include resettlement services for refugees, settlement services for immigrants, language services, employment services, community integration.
Order. I'm sorry, we've got some chatter in the room. If we could just focus on our speaker. Thank you. Ms. Watts.
As I was saying, among the services that we offer include community integration services, employer supports, and business development and entrepreneurship support. We deliver pre-arrival and post-arrival programs for immigrants destined to come to Nova Scotia that enable immigrants to arrive both better prepared and be successful in settlement and integration once here. And these programs are delivered through in-person, blended, and virtual delivery. We work provincially by delivering over 60 different programs across the province in rural areas and small centres that support immigrants, employers, and community groups active in settlement activities in coordination with settlement, community, and business partners. Meeting the needs of immigrants is key to our service delivery. ISANS staff do a comprehensive needs assessment with each client as part of our intake process to develop unique settlement pathways that ensure successful outcomes, working, of course, with partners when appropriate, including Francophone partners. Our programs cover a wide range of areas focusing on skill building, integration, and labour market attachment. We develop tailored programs that ensure successful outcomes. Examples of this would include labour sector-specific language training, employment supports, and actively working with employers and government partners on labour market needs, as well as addressing international qualification recognition barriers. ISANS deliver these programs using an empowerment, trauma-informed approach based on adult education principles to support an immigrant's ongoing journey and well-being. Our bridging programs support successful immigrant labour market attachment. Some of the recent bridging programs include early childhood educators, professional drivers, construction workers, and long-term care aides. We also offer specific programs for youth, young adults, and racially visible immigrant women. Our award-winning Digital Navigator programs support immigrants in building their digital skills, and community-based programs support the anti-racism capacity of nonprofits to build a more welcoming province. ISANS actively supports Canada's response to humanitarian crises worldwide, and we are supporting the increased number of government-assisted refugees arriving in Nova Scotia from all parts of the world. We are also actively engaged in recent specific humanitarian response initiatives, including the special programs for Afghanistan and Ukraine. As a settlement agreement holder, ISANS supports privately sponsored refugee settlements through family-linked applications. We do all this because of the support that we receive from our partners at IPG, but also from our federal government partners, as well as many community partners in the province. We live our values and are continually working towards a vision of a community where all can belong and grow. We, as I said, really are very appreciative of the funding and guidance that we engage with the provincial government, and see this as really helping to build a future for immigrants here in Nova Scotia. I'm happy to be here today, and I look forward to your comments and questions. Thank you.
Thank you, Ms. Watts, and I will just give our one MLA who hasn't been introduced yet an opportunity, Mr. Smith.
Hi, everyone. Apologies for my tardiness. My name is Kent Smith. I'm the MLA for the Eastern Shore.
Thank you, Mr. Smith. I understand both bridges are difficult this morning. With that, we'll begin with the first round of questioning. Each caucus will have 20 minutes. You may be in the middle of answering questions and time has elapsed, and I will interrupt you and just call order. I'm not being rude. I'm just trying to move things along and being fair. So with that, we will begin with the Liberal caucus, Mr. McGuire.
Thank you, Madam Chair. And as usual, I always start with, I'm going to ask a bunch of questions. I just ask that we keep the answers quick because we have very limited time. But I do want to make a quick comment before I start my questions. Is that I think it was the Deputy Minister said that people working in the department care about the work, and I agree with that. And I think that with every department, the people behind the scenes care a lot, and that's why they're there. And they could be probably making a lot more money somewhere else, but they choose to do public service, and it's appreciative. And sometimes I think we go a little hard in this committee and other committees, but know that it's more about finding the right answers. And I realize that everybody's under a tremendous amount of stress, so I appreciate the hard work that you and everyone else does. Having said that, 2 million is the number that we've heard from this government. Has your department met with the Premier about that number and how to achieve 2 million?
Ms. Czapalay.
Just acknowledging with thanks your comments about the staff. We'll pass that on. So I think the Premier's been pretty public about the 2 million by 2060, and we have had meetings and lots of discussion, and we know exactly what we need to do to get to 2 million by 2060. Essentially, it boils down to 25,000 growth in our population each year.
Mr. McGuire.
I'm glad that you said you know exactly what to do, like how to get there, obviously the numbers and stuff like that. So what kind of investment is going to be needed in our education system to get to 2 million people and have the education system to support it?
Deputy Czapalay.
By education system, do you mean the universities and the oh, okay, K to 12? Yeah. So thanks for the question. And it's very clear to us that we need to work across government to look at all government infrastructure. You mentioned schools, that's really important, but also healthcare, housing. There's a wide array of services and supports that are needed. One of the things that we're focused on is bringing in job-ready immigrants and newcomers from rest of Canada who come with the skills that are needed to help Nova Scotia prosper and grow. So we have an economic-based program that brings people in with job offers, ready to do work. Those people come with families, as you mentioned, and they come with the same aspirations that any other family would. They want their children in schools, they want their children in their hobbies and to have a nice life here. And so one of the things we've been fixed on for the past year is making sure that all regions of Nova Scotia benefit from population growth, so that all schools receive the same kinds of opportunities to have new children enter those schools. So our navigators are in 6 regions throughout the province, working diligently with newcomers to help them understand what kinds of opportunities are in those regions for work, but also for supporting the lives that people need. And also our settlement associations working across Nova Scotia to help people attach to communities where they will find work. So,
Mr. McGuire.
Well, I appreciate the answer. The question wasn't about that. It was about like physical space. So I look at the community that I represent, and almost every single school is over capacity. So right now, if you want to go to John W. McLeod, that school's at about 180% capacity. If you want to go to Kennard Junior High, that's over capacity. J.L. Leslie, which was just built, is nearing capacity. So I'm asking about physical space. So how many, do we know, have you had that discussion with the Premier, how many physical spaces, how many expansions, how many new schools, and how many teachers need to be hired to deal with a million more people?
Deputy Czapalay?
Yeah. So I think what we're going to find in the coming years, we're on track for record-breaking numbers again this year, as I mentioned in my opening remarks. So we're exceeding the 25,000 that we need. Part of the hard work that we do as a department is making sure that the people that come here are the people that we need to attach to our labor market. So our whole economy will grow. And by having people here attached to work adds to our tax base and grows our economy. So that's our first priority, is to bring people in, but also to work with the other departments so that they appreciate what our path is in terms of population growth. So the Department of Education, along with other departments, know that we're on track for 25,000 plus each year. I see you have a question, but I want to ask Jen as well to jump in.
Mr. McGuire?
What I'm trying to get at is that we have a healthcare crisis, we have a housing crisis, and bringing in 25,000 new people, which we want. Let me be clear. We heard stories last year of Ukrainians that were coming here that were homeless. We know that, and the Syrians who immigrated to this province, and a lot of them ended up in my community and have been a joy and a huge, welcome to the community. We know that a lot of them ended up in public housing, for example, and that has skyrocketed the list from 6 months to 3 years. So what I'm trying to get at is we're in the middle of a housing crisis. 120,000 Nova Scotians are without a family doctor and climbing rapidly. I think it's fair to ask when we're bringing people into this country, or into this province, sorry, that they're properly taken care of, and that includes housing, and that includes doctors. And to double the population in Nova Scotia, we just don't have the housing capacity. So my question is, how many new houses, just not the economy, but how many new housing units need to be built in Nova Scotia to deal with an extra million people?
Deputy Czapalay?
So there's no shortage of people wanting to come to Nova Scotia, none whatsoever. And our job is to make sure that we bring people in who are job ready. And you'll remember we have a marketing campaign. It's been very successful, extremely successful, over 100 million impressions on our website and on our media of people looking to come to Nova Scotia. The campaign focuses on skilled trades and healthcare workers. So prioritizing marketing to those groups so that people come here who can build our houses, who can create the infrastructure that we need to support our burgeoning population, who can work in our hospitals. So when I mentioned our participation in the Destination Canada fairs in Paris and Morocco, 83,000 people applied to attend those fairs. The Canadian Embassy screened those applicants for us down to about 5,000, but we had everyone from truck drivers to French teachers to doctors, nurses, all kinds of people. So our job in immigration and population growth is to bring in the qualified people that Nova Scotia needs to grow its economy, and to communicate the numbers of people that we're going to be bringing in so that the rest of the province can respond to that in an appropriate way.
Mr. McGuire?
It's great that we're bringing in people that can build houses, but we need to have houses for them to live in order to attract them. And if there's other jurisdictions that have housing for them to land in, affordable housing, and right now we have the second most expensive rent in all of Canada. And it grew by $600 last year, and it's climbing. So if I'm a new immigrant to this country, and I will say that my family did immigrate to this country, and I immigrated to this country, and I acknowledge that it was a lot different for me to immigrate as an English-speaking white man than it is for others. So I completely acknowledge that. But if individuals are immigrating to this country and they have to look at the housing market and they say, holy guacamole, it's $2,600 for a 2-bedroom in Nova Scotia, where it's $1,500 in New Brunswick, or it's $1,500 in another area. That is going to stop them from immigrating to this province, or it's at least going to give them pause. And so my question is, I know that we're bringing skilled trade people in, and for me, it's not just about skilled trade people, it's about people that need to immigrate to this province. We have, I'll give you an example. I've had many people in the Lebanese community reach out to me about the ongoing situation in Lebanon and how difficult it is for them to immigrate to this province now. And I would argue that under, I think it was Pierre Elliott Trudeau in the 70s, if anyone remembers the immigration from Lebanon, and that has been one of the most successful immigration policies this country's ever seen. And so it's not just about, skilled labor. It's about, as you know, and I know you know that. But again, what I'm trying to get at is, we are asking people to immigrate to this province when we are in the middle of a healthcare crisis where it's 6 to 8 hours at the IWK, where 45,000 youth went to the IWK and left without being seen, where you go to the QE2 and you can't be seen a lot of times. And that's not because of the staff, that's because of overcapacity. Spryfield used to be one of the most affordable places in all of Nova Scotia. It is now $3,000 for a 2 to 3 bedroom in Spryfield right now. Houses are selling for $700,000, $800,000 when they used to sell for $2 million. So again, what I ask is there a plan in place for capacity, not for bringing people in? So we're bringing 25,000 immigrants into this province this year. And if we didn't bring in 25,000 people into this province, the people that are here are struggling to find homes, and they're struggling to find health care, and they're in schools that are over capacity. So what plan is in place to ensure that those 25,000 people find an affordable home, a doctor, and a school where it's not over capacity?
Deputy Czapalay?
So thank you for that. You raise a really important point, and that is that people who come here have choices. They have many choices. And so it's us working with community partners, with our settlement associations, with our organizations throughout Nova Scotia to ensure that those people who are considering coming to Nova Scotia receive the information that they need to make a decision. Because we can tell them about Nova Scotia, we can connect them to an employer and help them find a job, but if they don't have housing, if they don't have a school for their child, if they don't have other things, then they will go elsewhere. So that point was excellent, and it's one that I think sometimes we forget to emphasize, is that people have choices. And we certainly saw that in Paris and Morocco, that with the rest of Canada there, all the jurisdictions, including the jurisdictions in the north, were recruiting for people to come. So for us, I think the best thing that we can do in immigration and population growth is be consistent in our forecasting in terms of what the numbers will be, so that plans can be put into place. And also, I mentioned the navigators. So having the navigators in communities, working with the regional enterprise network and working with the chambers and working with all the community partners to ensure that there's a really good understanding of what the assets are in those communities to support newcomers.
Mr. McGuire.
I'm glad you brought up navigators. So housing navigators in particular are quitting. So that's what's happening. So they're bringing in housing navigators to find homes for individuals and communities, and they're quitting because there's no housing. And so I realize that it's your job to forecast the amount of new immigrants coming in, but it's also your job, I would think, and correct me if I'm wrong, as Labor Skills and Immigration, to make sure that those individuals are fully supported. And right now, I would argue that they're not fully supported. We have family of 6 and 8 and sometimes 10 people in my community living in 2 bedrooms, 3 bedrooms, right? We see this all the time. We're dealing My office works daily with the new immigrants in our community. We support them, we help them through events, and some of the things that we saw was they weren't getting the proper support in schools, language support. Their parents were not getting the proper support after schools. The housing situation was, quite frankly, if I could just be frank, was a mess. And I'm not blaming you, because that's not your job. Your job is not to deal with the housing stock and the housing situation. And what ends up happening, and what we've heard from a lot of the new immigrants that have come into this province, is that the moment they can afford to, they're leaving. That's what they're telling me. The housing's too expensive. That the support was not there in place for their children in schools. And that's depressing, right? Because I truly believe that Nova Scotia is the best place to live in Canada, and I think Nova Scotia for you is kind of an easy sell. I mean, I don't mean that like your job's easy. I think if you compare Nova Scotia to other places, it's and truthfully, most people want to live in an urban core, right? We know that. Like when new immigrants are coming in, they want to live in walkable distance to things, and that's another thing that we have to deal with rural Nova Scotia, and is that showing them the beauty and everything that is rural Nova Scotia. So do you believe that the infrastructure, this is kind of a yes or no question, do you believe that the infrastructure is in place, schools, transit, and that includes rural Nova Scotia, housing, healthcare, education, do you believe that the proper infrastructure is in place right now to support 25,000 new immigrants a year and 2 million by 2060?
Deputy Czapalay?
So I think if we utilize our navigators and work with our partners across Nova Scotia, we can capitalize on any available infrastructure. You make a good point in that immigrants tend initially to think about an urban setting like Halifax or Sydney. I think we need to really encourage immigrants to see the value of living outside of urban centres, and it may come down, excuse me, it may come down to the availability of housing and work in a particular rural setting as opposed to urban. We do know also that having more than one family in a particular area might, if it's rural, might lend to that feeling of support and home.
Mr. McGuire.
So that was my next observation, is I think that, I mean, I've had the privilege to travel quite a bit, and I did the backpacking thing when I was younger and stuff like that, and I think one of the things that you noticed is that the beauty that is when cities are culturally diverse, and, you know, as with anyone, you know, you want to go to a place where you can get your food and when you can get your culture and you can have those conversations and things like that. And I think it is difficult, and I'm glad that you said that. Like, you know, I think it's very difficult to put a, and I'm just using, like Meat Cove, for example, like to put a Syrian family in Meat Cove by themselves, right? It's probably not going to be successful. And not to say anything about Meat Cove, it's just that if you're the only individual there and you can't get the food and the things that you need, then you're not going to stay. I do have it's a kind of a strange question, but there was one of my there's a cab driver that I used to see all the time, and he was a Russian cab driver. This was years ago. He actually moved back to Russia. Tried to get me to play poker with him, and I was like, I don't know about that. But he was actually a nuclear scientist, and he was a cab driver. There's a lady that was just in my office the other day who was a GP in England, and the list goes on and on and on. And we are seeing a difficulty of individuals transitioning their skills from their country to here. And sometimes it costs a lot of money to do that. I think money is a barrier. I think time is a barrier. And so I wonder if there's any thought to removing the financial burden that is on individuals when they're coming to this. I mean, it's expensive anyways to come to this country and set up anew. So I'm wondering if it's worth waiving, and I think it is, these financial burdens so that individuals will come here and set up as doctors and set up as, and streamline the transition from whatever profession they're in to here in Nova Scotia because we know we're in desperate need for a lot of it. I think Mrs. Watts is going to, I see her shaking her head.
Okay, so just so you know, there's one minute left in the Liberal questioning time. Ms. Watts.
Thank you, Brendan, for the question. I think we at ISENS have been working on international qualification for at least a decade, and we've been doing that with the support of the provincial government. We look at both at systemic barriers, so working with regulated professions to remove barriers, but we also have design programs to help people who are coming in with a profession or a trade to receive their accreditation. And we develop very specific programs to help them on that pathway and also help them develop strategies. It is not easy. There has been a lot of movement, though, to be very honest, a lot of movement in a very positive direction around that. And we also have a loan fund. We have been developed this now and actually have just gotten approved again for the delivery of a loan fund to help people meet, if they have to write exams, they need to get to Montreal to write an exam or to buy equipment, for their trade. That is available through our programs. So we've been able to put together systemic barriers, trying to reduce those, but also very specific training programs which have been hugely successful.
The time for the Liberal questioning has elapsed. We will now move on to the NDP, and I would just like to make a quick introduction here. Ms. LeBlanc.
Good morning, everyone. I'm sorry I was late. It was Bridget's fault. Susan LeBlanc, Dartmouth North.
Ms. Coombs.
Thank you and welcome. So I'm going to start with a few questions with regards to the labor market needs. So on page 26 of the Auditor General's report, 1.32, the AG pointed out that the department needs a process to identify labor market needs in order to ensure that Nova Scotia nominee program is as effective as possible. And so can you explain what work the department is doing on this?
Deputy Czapalay.
Thank you for the question. So we appreciated the Auditor General's recommendation in this regard, and that is to come up with a process to ensure consistency. So right now, in order to identify labor market needs, we regularly monitor and access labor market information, both from sector associations, from the federal government, Service Canada, from our labor market economists that we have at Immigration and Population Growth and Labor Skills and Immigration, and also employers themselves and employer groups meet with us on a regular basis to give us real-time updates on what they're seeing and hearing and experiencing. And so so we access all of this information. We have it at our fingertips. What we're being asked to do is come up with a documented process to make sure it's utilized consistently, and we appreciate that, and we'll be doing that.
Ms. Coombs.
Thank you very much. And so my next question is regarding it's on page 32, it's 1.55. The AG also pointed out that the department will need to significantly more comprehensive performance indicators in order to reach the ambitious immigration goals of this government. And so question is, what progress is being made here?
Deputy Czapalay.
I'd like to ask Jen Lesperance to answer that question.
Ms. Lesperance.
Sure. Thank you for the question. So the report also said that we are exceeding our current indicators. So we know that the people that we're targeting to come and attracting to come, we're attracting more than we are anticipating. We're remaining consistent with our retention, but we do have aspirations to have higher retention. So they want to see that those performance indicators meet that aspiration as well. As we grow with our investigations and fraud unit, our targets and our indicators might also encompass that unit because it is a brand new unit. As our branch has grown over the years to meet our ambitious goals, we need to make sure that our performance indicators grow with the growth of our branch, and we are putting that in place now.
Ms. Coombs?
So when will the performance indicators be ready, and how can they be made available to the committee?
Ms. Lesperance?
Sure. So we release our performance indicators each year with our business plan. So our next business plan would include additional performance indicators.
Ms. Coombs?
Thank you very much. I'm going on to, it's on page, I'm now actually going page 33. It's point 159, where the AG pointed out the number of issues around monitoring of settlement service providers. And it appears unknown whether the 6.5 million per year spending on settlement services is achieving its objective of retaining immigrants. So the AG pointed out there's no analysis at the department to determine the settlement needs of immigrants, no analysis at the department to determine the no improvements needed to assess funding proposals from settlement service providers. Annual audited financial statements are not required. And sufficient documentation from service providers assess whether its funding is used for intended purposes and are not obtained. And so there's a few things to unpack here. And one of those things is the settlement needs of immigrants. And I think this goes to what my colleague, Mr. McGuire, was trying to get at, and that is various needs. It's community needs, it's food, housing, medical care, education for children. All of that needs to be there, as well as culturally relevant foods, culturally relevant social gatherings and things like that. And so my question is, if we are going to retain people here, what specifically is being done to ensure that, for one, determine the needs of the immigrants, whether that is even language barriers? What is being done specifically to make sure that that is happening, and how are you doing it?
Ms. Lesperance?
Thank you for the question. It's a really important question, and it's very important to us to make sure that our funding and our supports are directly attributing to those needs of the newcomers, ensuring that they can be successful in our communities and in our workplaces, and we work very hard to do that. What the Auditor General has identified is that while we've completed research in the past, we have a research document called Stayers and Leavers to really understand why people might stay in the province, why people might go. We also did a socioeconomic profile of newcomers in the province to understand their demographics and a good profile of newcomers in the province. That we really needed to go one step further and understand those needs of the newcomers and what those services and programs might be. Currently, we rely quite heavily on the 18 different service providers across the province that we support with settlement funding. They provide reports to us frequently on the services that they provide. And maybe Ms. Watts can talk a little bit about how the province is responsive to those needs with our funding. But since the Auditor General began their review, we've also commissioned a report for settlement needs for the province. And so we will be looking at that analysis ourselves from a provincial view, while still taking into account some of that responses from the settlement service providers as well. But you might want to comment on that.
Ms. Watt? Oh,
Okay.
Ms. Coombs?
Sure.
This might actually go with what, to you, Ms. Watts, and that is, so with regards to all of that I just said, many times it seems that there was also firsthand knowledge that what they found was 42% of the immigrants who stayed in the province, 52 immigrants left, did not even access the settlement services, and others stated that they didn't even know they existed. So I'm just wondering, so in that question is, if they don't even know settlement services exist, and they have no access to them, how are we determining how we meet their needs if they don't access or they can't access? And that goes to the question of areas of rural areas where services may not even, and that's also in the report, that there hasn't been a clear acknowledgement of where services need to be put into it. So I'm wondering, Ms. Watts, if you could speak to that issue.
Ms. Watts?
Thank you. I think in response to that, we actively engage with many people in the delivery and design of our programs. So we do, as I mentioned at the beginning, a very intensive needs assessment with every client that comes through our doors. Last year, we served over 10,000 clients. And so we gather that information. Our staff teams, because we're a wraparound service, our employment team is always talking to our language teams. So because people come in with different needs and different cohorts have different needs. And so to design static programs is not going to be responsive and flexible to what immigration needs to be and to moving forward. We also know that when we have humanitarian crises, they represent a new, important response that needs to be, again, tailored and flexible. We have found generally that the response in our engagement with the province, with the department, has been very good, in terms of defining what labor market need is, because we also work a lot with employers. So employers often come to us saying we have a desperate need for programs. So we sit down, we talk about programs, we work with our partners, both in IPG and other provincial departments, to develop tailored specific programs to meet labor market need. One of the big issues that we find around retention is the key one, is the sense of belonging. It's about people feeling the connection here, because anywhere in Canada, there's going to be a housing crisis. No one's going to have a doctor. I mean, it's not unique to Nova Scotia. And so really retaining people here in the province of Nova Scotia is about people feeling, I see my future here, and I have the sense of belong. So a lot of it is about building welcoming communities, and we do that in partnership with community groups, employers, the academic community. There's a whole bunch of people that play a role in that. No one group carries that by itself, but that's a lot of our work, again, which is supported by IPG around welcoming communities, building culturally competent workplaces. That is really key.
Ms. Coombs, you have just over 9 minutes left.
So
Ms. Coombs.
just going back on this, where people had said that they didn't access services because they didn't know they existed, they were not available in the area they were, individuals were living in, often outside of Halifax, or were unable to get appointments with the service provider. And so I'm wondering if the department can really speak to this and what is being done to ensure that people do have access wherever they are in the province, are able to get appointments, but first of all, even know it exists.
Ms. Lesperance?
Thank you for that, and it is something that we're definitely working very hard on. A couple of years ago, when we did our stayers and leavers research, it identified that communication piece. What more can we do to make people know that our settlement services are available? And not everyone needs it. We do have economic provincial programs. That's what we do here. So people are coming with the means to set up a life for themselves, but they still may need that community connectedness. The person who's not the principal applicant, the spouse or the children, might need some additional language supports. So we are aware that there are some settlement requirements there. So what we started doing after that research was when we nominate an individual, we actually provide them communication about settlement services. It seemed like a simple change, but it has seemed to make a difference. And since that time, another change that's happened is that we are now getting more newcomers in more rural areas in Nova Scotia, which is fantastic. It's something that we've worked really, really hard to achieve, is to spread immigration and that diversity and innovation throughout our province. And we're being successful now, which means we also need to provide the supports around the province. So our navigators are a really great, tangible outcome that we've had from there. We have 6 navigators across our province. And they can not only provide that connectivity, but they can connect the services in the areas to make sure that people know where to go to get the right type of supports that they need.
Ms. Coombs?
And so I want to talk about the annual audited financial statements are not being required. Now, working with community and community organizations, even for small grants, they have to provide every year their audited statements to government. Now, this is a lot of money happening, here, and the annual audited statements are not it said in the report that it was not required. And so I have a concern for that, because I think if small little organizations like Lions Clubs or seniors and pensioners clubs and stuff like that have to continuously provide their audit statements every year, and these big organizations who are doing this, whether it's partnerships, the Cape Breton or Halifax partnerships, or Mike, so why haven't they been required to happen every year with this amount of money?
Ms. Les-Browns?
So we use a system called LAMPS that has a process for evaluating our grants and contributions, and we ensure we get financial statements, pay stubs, and different documents to ensure that our funding is being used in the way that it's required. Now, ISANS would have audited financial statements, by an auditor that is, there's a charge to that as well. One thing we want to do with our funding is ensure that cultural community groups can participate in settlement as well, that they can help newcomers settle in communities because they can help people find that connectivity in communities. So we are going to enhance our requirements of financial audits as suggested and recommended in the report. However, the independently verified audit might be a step too far, might preclude some of these groups from actually participating. So we are a little bit cautious there. We're going to pay close attention to make sure that we are doing the due diligence we need to make sure that the money is being used wisely while not precluding groups from actually participating.
Ms. Coombs?
Also in the report, the Auditor General found that there was no training plan for staff responsible for assessing applications to the Nova Scotia nominee program, or the Atlantic Immigration Pilot Management has not assessed the training needs of staff as well. And I'm just wondering, is the department working on a training program? And what kind of training program is it going to? Because I know we all take this thing online that it's not real training, as far as I'm concerned. That little video that we get to do stuff is not adequate training. It's not I don't think it's even appropriate training for types of things of fraud and understanding fraud, or doing sensitivity training and cultural relevancy training. So I'm just wondering, what specific types of program training is the government planning, and when will it be in place?
So we have just under 4 minutes left. Ms. Les-Browns?
Thank you for the question. This is an important recommendation for us as well, because we are growing. We're again, we have big plans, and we are growing to make sure that we're meeting our commitments. I can assure you that individuals in our office are trained. They have orientation, they have onboarding, they have training for their individual needs. The Auditor General found that of the large amount of time they spent in our office looking at all of our applications, they were assessed correctly. All decisions were made in the way that they should have been made. They found that 90 compliance and investigation reviews were completed, and they all came to a reasonable conclusion and were dealt with accordingly. However, we do not have one consistent training manual for our whole office that would account for every position and the requirements that are needed for every position. And that's the thing that we're working on now. So I don't have off the top of my head specifically the date that we said for implementation, but it's going to take some time because we do want to do it right. As you've suggested, not all training is as effective as we need it to be. And this is important. This is people's personal information that we're assessing. We want to do it with care and make sure it has the care that it needs to get to the right decision. And so we'll be making sure that that training plan is comprehensive and really addresses every single position in our office.
Ms. Coombs?
Yes, I was actually going to hand it off to my colleague, but then you said something that I want to unpack a little bit, and that is, when I read the report, I can't find it now, but the Auditor General said in the report that when they took a number of files and they went through and they assessed, they found that there was various degrees of application processes, whether there was reasons as to why somebody was denied, and there was a full documentation. Others just had denied. There was nothing that was set. There was no, this is the form, this is how you do it, this is the appropriate steps that you need to take. And so when you said that found done correctly, there didn't seem to be actually a process for how they're supposed to be done correctly. Do you understand what I'm saying? So there was this, I can't find it now, I just lost it, but in the report, the Auditor General did state that this was an issue. And so I'm just wondering, how can we say that these documents were done correctly when there didn't seem to be, when the review was done, there didn't seem to be actually a set correct way to do it?
Ms. Lesperance?
Thank you. So all assessments have an assessment form. So it's very clear in the criteria that need to be met. However, there were some assessment forms that if it said language needs to be a CLB 5, some had a check mark and others had language has been reviewed and it is a CLB 5. And so that was the inconsistencies. However, the correct decisions were being made. So it wasn't resulting in incorrect decisions, but those assessment forms could have a process document behind them that would ensure that the way that they were assessed is more consistent, and that's what we'll be working on. Yeah.
Ms. Coombs, you have 30 seconds.
Thank you for the clarity. I appreciate that clarity on what we were discussing. And so just thank you very much.
Okay, over to Mr. Young.
Thank you, Madam Chair. My questions are going to be around labor shortages. And, you know, I spent some time living in Alberta when we had labor shortages. And when there was labor shortages, wages go up and increase your cost of living. But I think we have the lowest unemployment rate since 1974, which is a good thing, some would argue, and the highest full-time unemployment or full-time employment rate, I think, maybe ever. But besides that, a couple of things. I want to talk about, in particular, labor shortages. Can you discuss the current labor shortages and how your department is addressing them?
Deputy Czapalay?
Yeah, thank you for the question. And certainly, it's not lost to any of us here in this room that we still have jobs without people and people without jobs. There's, even with the low unemployment rate, we are contacted all the time by employers and employer associations and various groups saying, can you find us people? And the people range everyone from, I need someone to come unload a truck. One employer told us that he would have 25 people invited to show up some morning to unload a truck, and maybe 2 would show up and 1 would quit before the truck was unloaded. You know, there are stories like that, and you would hear all of those stories, I'm sure. So we are very well aware that we need a wide array of labor, not just skilled labor. We need all kinds of labor here in Nova Scotia. And if we're growing our population, we need to be very well aware of where those labor requirements are, and also being aware of what the needs are in various jurisdictions throughout Nova Scotia. And so I mentioned in our initial remarks that we've had a marketing campaign underway for the last year, 12 months, really focusing on skilled trades and on healthcare workers. That's not to say we haven't had a wide array of other workers indicate an interest in opportunities in Nova Scotia, but really focusing on skilled trades and healthcare workers is a priority for us. And so we also work with the sector associations, various employer groups, the regional enterprise networks, just to get a really solid understanding of what the labor shortages are today and what they might be tomorrow. And are those shortages inhibiting potential growth in different regions? With respect to immigration and population growth, that can be a solution. So if an employer looks locally and does not find the labor that they need to complete the jobs that they have available, then they can turn to immigration. And oftentimes they'll reach out to Jennifer or a member of her team and talk things through and indicate what kinds of workers they need and the type of work. Our immigration programs are economic programs, and employers need to be offering someone a full-time permanent job 12 months of the year. And so Jennifer and her team have come up with a whole variety of solutions, working with different organizations to help them meet their labor market needs through immigration.
Mr. Young?
Thank you, Madam Chair. I have an analogy. I think Nova Scotians are like homing pigeons, and we all want to come home. And in fact, I'm no different, right? I spent many years out west, and I look at friends and family that have moved back because of the good paying jobs we have, not only in Halifax, but in rural Nova Scotia. And I do see growth in rural Nova Scotia. I walk down the street, there's all kinds of new family that we've welcomed into the area, and that's it's a great thing. But you did mention healthcare, the healthcare sector. I think MLA McGuire did as well. So I'm just curious, what are we doing to reduce barriers for new Canadians wishing to work in the healthcare sector?
Ms. Watts?
Thank you. Thank you for the question. As I mentioned earlier, the pathway for people to have their qualifications recognized has been a long-term project that we've been working with in the province. We've seen many new developments in terms of reducing those barriers, and as I mentioned before, it's about the systemic barriers of working with the actual professional bodies to reduce that. We've had huge success, particularly with engineers, in developing programs and moving forward. And we've been very active both with international medical graduates, so doctors, nurses, and also working to address the need around medical lab technologists. So those are kind of the three big areas that we hear a lot about. And that is about developing specific programs that help them gain their training and go through the prep for exams, to learn about what the situation is at the actual workplace, to develop and improve their language skills, particularly for nurses. This is a very big issue. They have a very high level of English language skill that they need to have through the CEL ban. And so we have very targeted programs that assist that. And we have a fabulous feedback from clients who have gone through. I was just reading one story about a internationally educated nurse in Badek who went through the program because we're able to deliver these programs virtually. So I think in response to some of the previous questions about how does this actually impact across the province, we do a lot of our program delivery virtually and also go in person when important to do that. And so through that type of program, she was actually able to gain the confidence, but she also said about understanding what it's like to work in the hospital, like connecting with nurses here, because we mentor and match people who have been working, who are doctors and nurses here, with incoming folks, so they get that kind of soft cultural communication skill, understanding. So some very hard skill development, but also soft skill development that really enables people to move forward. So we're seeing some very significant movement forward. And I would say particularly in the past year around international medical graduates, there's been some very key changes in the province about enabling people to move forward on having their credentials recognized. Certainly there's a lot more work. We recognize that, and we're very actively involved, but I think a lot of partners are coming to the table to work on this because we understand the need around meeting the healthcare shortages in terms of medical staff and really responding through the immigrants who are very interested in coming and staying here and seeing, putting roots down here to making that successful for them.
Mr. Young?
Just one more. When we formed government, we brought together immigration and labor and skills into one department. And I'm just wondering how we can expect this new structure to better allow us to understand labor market needs through immigration.
Deputy Czapalay?
Well, from my perspective, it was a great move. It works really, really well. It makes a lot of sense to have immigration tied into labor, especially everything we've talked about this morning in terms of attracting the labor that we need from other countries and from rest of Canada to come here and meet our job requirements here in Nova Scotia. So Jen L'Esperance has the benefit of the labor market economists who are with our policy branch in labor skills and immigration. She has the benefit of working with our skills and learning branch. So that would be the Nova Scotia Works programs that have offices in 53 locations throughout Nova Scotia, helping people be job ready and get the training and skills they need. Jen works closely with the apprenticeship agency. You were waiting for me to probably mention your favorite. So, attracting skilled workers and helping people make sure their credentials are transferable in skilled labor. So, in short, it's been very, very beneficial. Our department has 500 plus people, and Jen's branch has 58 or almost 60. And so she's part of a bigger pool of resources within government, all focused on helping people connect to work.
Mr. Young?
Yeah, I just want to say thank you very much for the information. That's awesome work, and I'll pass it over to my colleague, Mr. Smith.
Mr. Smith?
Thank you, Madam Chair. Thank you again to the witnesses for being here. I want to start by just maybe highlighting a couple of the differences between my constituency and that of my colleague from Halifax Atlantic. I don't wish to be contrary. We're all trying to get along and be nice on this committee, but I just wanted to say that a couple of things that he experiences in his constituency are different than mine. So we have a housing navigator on the Eastern Shore who has been with us for over a year, and she is gainfully employed. She works closely with my office. No indication that she's planning on quitting or anything like that anytime soon. She's excited when she gets to help a newcomer or any constituent for that matter. And to that end, we also have a Ukrainian family that wanted to move to rural. So it's a mom and 2 kids who came to rural Nova Scotia. I don't know if they were interested in heading to the downtown core. I think that they were familiar with rural living, and that's where they wanted to be. And it's a real feel-good story because the mom actually ended up working at our local tourist museum for the summer in Musquodoboit Harbor, and then upon the completion of the summer, she ended up getting a job at the local school. So it's a feel-good story that she's come to rural and contributing to our economy and was resourceful in finding housing for herself. But we do have a target of increasing retention from 71 to 75%, as highlighted in the AG report. So what are we doing to help families like this Ukrainian family that wants to be in rural, wants to be here and contributing to our economy? So what are we doing to keep her and to increase the retention rate by almost 5%?
Before we get to Deputy Czapalay, I'll just say you have 10 minutes left. Deputy Czapalay.
Thanks very much. Well, I think Minister Balser's been the biggest voice on welcoming communities and retention. So when I first started as Deputy for Immigration, I remember asking Jen about the retention rate and finding out it was 71% and going, what? And then Jen quickly assured me that it's the best in Atlantic Canada and close to 2 other provinces in rest of Canada, Manitoba and Saskatchewan. So to me, I look at the 29% that are not being retained, and probably with various stories about, maybe they weren't happy or maybe they didn't have a good experience. So we are very laser focused on increasing our retention rate. And we said to 75%, but we would like to obviously increase it by much more than that. You point out the navigators, and that brings up a really important feature, is that personal connection to communities is what will help ensure that each individual has a good experience and stays here. And so, yes, we have a myriad of navigators, housing and health navigators, and we have our navigators and so on. What it really boils down to is recognition that it's a personal contact. It's someone who's willing to be helpful and connect someone to a service or an opportunity that they need to be connected with in order to settle here and to enjoy their life here. So, Minister Balser's been on a bit of a speaking tour, really putting out the word that we need. This can't be just staff, in immigration and population growth who call for welcoming communities. It needs to be our settlement associations. It needs to be our MLAs. It needs to be our employer groups and our sector associations and our workplaces and our cultural associations. We need to wrap our arms around these newcomers and say, we want you. You're welcome. Please stay. Don't leave because a neighbor didn't come over and introduce themselves. Don't leave because you're lonely or that you were bullied at work, and anything like that. So we have taken a lot of measures. In our Atlantic AIP program, we've introduced a required cultural competency program that's online for all employers to take to make sure that workplaces are as welcoming as they can be. And we're really just calling on everyone to help us out with this message that Nova Scotia is truly welcoming and we want newcomers to stay.
Mr. Smith?
Thank you, and I certainly appreciate that. Again, in my constituency, we have the Musquodoboit Harbour and Area Chamber of Commerce and Civic Affairs. And we have the Sheet Harbour Chamber of Commerce and Civic Affairs. And those two organizations in those rural communities are actively helping, trying to attract and retain not only healthcare workers, which is what we need on the Eastern Shore more than anything, but new workforce in general. But I'll turn my attention just briefly to Ms. Watts, perhaps, who can answer this question for me. I'm interested in the difference between the Atlantic Immigration Program and the Nova Scotia Provincial Nominee Program, and how we're using those assets to the best of our abilities.
Ms. Watts?
Still see it.
Ms. Watts? Or Ms. Lesbros?
That's great. That's great. Thank you for the question. So we do have two provincial economic programs, the Atlantic Immigration Program and the Provincial Nominee Program. The Atlantic Immigration Program is really a federal program that we administer the employer portion of that program. And the Provincial Nominee Program is a joint jurisdiction, but we have the ability to select the candidates that we need in our economy, that we need for our employers as well. So we do use them very strategically. The Atlantic Immigration Program has been a fantastic asset to really spread newcomers across the province. Because it's employer-led, newcomers are going to where the employers need them most, and in many times that is to rural Nova Scotia. I know to date this year, about half of our endorsements, so our candidate applications that have come through AIP, are in fact outside of Halifax. So that's a huge benefit to rural Nova Scotia, and because traditionally newcomers, about 80% come to Halifax. So it really has been fantastic there. The Atlantic Immigration Program also requires an individual settlement plan for each candidate. So that is where ISANs and other organizations do support that for us. And then our provincial nominee program, we have a little bit more flexibility with the streams. So that's where we can really look at those labor needs and say, for example, I know the Auditor General pointed this out as well. During COVID, we realized that we needed more cleaners in hospital. So we looked at what that occupational code was, and we added it to a stream we call occupations in demand, where for lower skilled workers, it would not require that worker to work with the employer for 6 months before being able to be eligible for our programs. So we could recruit directly overseas, like those accommodations that we've made for transport truck drivers and continuing care assistants. So we can, and we also have two specific physician streams with our provincial nominee program. So that's where we can be really innovative and responsive, very, very responsive. We have a fantastic relationship with the federal government. So they allow us, we negotiate, they allow us to be quite responsive with our programs to identify those labor needs, make those adjustments where needed. And then the Atlantic Immigration Program, again, is employer-driven, but I will mention one more thing about the Atlantic Immigration Program. It has this unique asset where international graduates don't need work experience before coming through the program. So that's really unique to Atlantic Canada and is an attraction mechanism that we can use to say that if you're an international graduate here, yes, you have access to your post-grad work permit, but you don't need to work on that for a year before coming into our programs as you would in most other provinces.
Czapalay Smith, you have just under 3 minutes.
Perfect. Thank you, Mr. Chair. I'm just going to ask one quick follow-up. Mr. Lesbos, you mentioned 80% immigrants coming to Halifax. Can you give me a breakdown on that? Is that Halifax proper? Because there's a lot of discussion in my neck of the woods that Halifax, HRM goes all the way to Ekum-Sekum. So when we talk about 80% going to Halifax, are we looking at the downtown core, and do you consider the rural parts of the HRM?
Ms. Lesbros?
It is Halifax County, so the larger Halifax rather than the Halifax City. Yes.
Mr. Smith?
Thank you. I would love to see as much of a breakdown as you possibly could. It'd be interesting for me and my constituency. That concludes my line of questioning. I believe my colleagues have some more.
Mr. Palmer? Mr. Palmer.
Thank you, Madam Chair. I just want to quickly expand on the comments made by my friend, Mr. Smith, in regards to the welcoming nature of rural Nova Scotia communities I represent, like Berwick and Kingston. There's been many families who were part of those first flights from welcoming Ukrainians back in the early spring. And very pleased and proud of the work that's being done with families. And I know I've been in communication with the Y-Reach coordinator in through the valley. They've been a great resource. Could you maybe elaborate a bit more? And we might run out of time, but I may come back in another round. Can you elaborate on some of the work that's been happening with regards to the Ukrainian settlement? And maybe elaborate a bit on what we've already discussed, but any more details on that, please?
Ms. Lesperance?
Thank you for the question. We've taken the welcoming and settlement of Ukrainian newcomers very seriously, and we have been recognized across the country for our fast and flexible response that we've had. We've never seen anything like this. So people coming from Ukraine are coming on a temporary authorization for travel, which is not as a permanent resident or as a refugee. So the eligibility for services is different than other newcomers who are coming. So we've had a cross-government response with our education and our healthcare colleagues and community services to make sure that these newcomers can access the services that other newcomers can. And I can also assure you that there's been a lot of efforts to make sure that there are safe places to stay for all Ukrainian newcomers as well. So there have been temporary accommodations that have been provided to make sure that people have that emergency response that's needed. We have a booth at the airport to welcome people. We've worked with ISANS as well as our Y-Reach, the YMCA program colleagues. There's a website that you can go on at the Y-Reach site that people can say if they'd like to support Ukrainians, employers can say if they have jobs, and Ukrainians can also register to say if they'd like to have that support. So the coordination around this has really been something that I know has been looked at across the country, which is why we were able to get that flight, one of the 3 chartered flights that the federal government had that came to Nova Scotia.
Order. Time for PC questioning has elapsed. We'll now do our second round, which will involve each caucus having 9 minutes. Mr. McGuire.
Thank you for being here today and answering questions. We only have a few minutes, so I need some direct answers, please. Do you feel right now that the province is in a position to support, and by the province I mean our systems, are they in a situation to support 25,000 newcomers to this province a year and 2 million people by 2060? Just yes or no, do you feel like they're in a situation to support that?
Deputy Czapalay?
Yeah, it's our hope that as we grow our population, the systems will grow as well, at bringing in the job-ready people that we need to contribute to our labor market means that we're bringing in people that will add to our tax base. And as our tax base grows, in order to support that growing population, as you mentioned, right through to 2060, we need to grow our infrastructure.
Mr. McGuire?
So, growing our tax base, this kind of putting the cart before the horse. So, I'll give you a good example. Right now, Elizabeth Sutherland School in my community now has they're over capacity, and they just got from Halifax Regional Centre for Education that they now have to have the what do you call them outside? Modules. So that school's not at capacity, or it does not have the capacity to bring in new people. Rockingstone's at capacity, does not have the potential to bring in new people. J.L. Ilsley is. William King Elementary, Sambro Elementary. To say that bringing in new immigrants will grow the tax that government receives is absolutely correct. But there needs to be a sizable investment before they come, right? There need to be a sizable investment in housing, and there need to be a sizable investment in education. And we just saw in one of the committee meetings where the president of the NSTEU just said, Ryan Lutz just said that they're in a crisis situation. That we saw from Dr. Link and Dr. Strang that healthcare is the worst. Dr. Link actually said he's been doing this since the 90s, and that the IWK is the worst he's ever seen it. So what I'm trying to get at is, has the department worked with the government to say, we need this much investment in infrastructure before we bring people in to ensure that they are successful and that Nova Scotians continue to be successful, because bringing them in and hoping that our systems survive where they're barely surviving now is not going to work.
Deputy Czapalay?
So for us, we go back to the predictability. We know that we know this year we're going to exceed the 25,000 a year that we need to reach the 2 million by 2060, and we believe that we're on track to exceed that next year as well. So the 25,000 per year is that predictability. And so then we're working with our community contacts throughout Nova Scotia to make sure that people see options throughout Nova Scotia, not just in HRM, but also in other centres throughout the province, including rural Nova Scotia. Not every school in Nova Scotia is at capacity, so where are the schools that have the capacity? Helping people understand where the jobs are. And maybe looking at jobs where there are the other community supports that they need, depending on their family configuration. And so we're just, as I mentioned before, working with people, navigators, to communicate with newcomers to say, these are the assets in this community. Do you want to come here? And helping people arrive at the decision as whether or not they want to come based on what's available.
Mr. McGuire, 5 minutes.
So we've heard from, and I'm just using schools for example, we've heard from teachers, the union, and from the Department of Education that our schools are stretched thin. So when you're making these decisions, you're making it based on some of these things. Which areas have schools that are not over capacity, where new immigrants come in and be able to be part of those school systems?
Deputy Czapalay?
So the very first thing that an immigrant needs in order to come through one of our programs is a job offer. So when they have a job offer, then they have to assess what else do I need in order to settle? Are they coming by themselves? Are they working remotely? Are they bringing a family? What's the size and age and configuration of the family? As you can appreciate, there's a multitude of scenarios there. And so
Mr. McGuire, 4 minutes.
Respectfully, this wasn't about the process. Respectfully, the question was which areas have school capacity?
Deputy Czapalay?
Respectfully back, immigration and population growth is about bringing people here and working hard to help people see what opportunities are in the communities where they have job opportunities, and communicating across all of our departments what our growth will be in the coming year, so that the departments know. But people are driven by job opportunities and will choose communities where they have those opportunities, and they will decide what kinds of supports and structures that they need. Also working with the settlement associations.
Mr. McGuire?
Thank you. I would argue that it's a little bit more about jobs than it is, it's not just about jobs, it's also about housing, it's also about education, it's also about healthcare. And if they're coming here, and like I said, we've heard stories about new immigrants that have been homeless, new immigrants that are 9 and 10 people to a 2-bedroom, they are going to leave. When we speak to them, they are going to leave. That's what they say to me. The moment I can afford it, I'm leaving Nova Scotia for a place where it's more affordable and it's I don't have 4 kids to 1 bed, and that's what's happening. And that's not just in Halifax, that's all over the place. And also, we do have a housing crisis from one tip of Nova Scotia to the next. It's not just in HRM. We know that it's everywhere. If you go to Amherst, you go to Cape Breton, or you go to Yarmouth, there's a housing crisis. And so what I'm trying to get at, and I'm finding it very difficult to get the answer, is that I'm just asking, and this isn't on you, but you are part of the solution, I'll say. We need to know that when new immigrants come to this province, that they're properly set up to succeed so they stay. And part of that is having a comprehensive plan around housing, education, and healthcare, and jobs. Is there a comprehensive plan? So your department should be at the center of this to ensure that when someone comes in, that they're set up properly and that the resources are there. And if there isn't, which we know that there is a crisis, what is the investment that needs to be made to ensure that these new immigrants to our province succeed?
Deputy Czapalay?
I think Jennifer Watts, did you want to answer part of that question?
Ms. Watts?
Okay. Thank you. We work very hard when people come to us when I was mentioning about the intake needs assessment, about strategies to help people figure out how to settle here. We also look in that needs assessment of who's coming with them. So in reference to comments about how to have that family settle and anchor into the community. Really, it is a very interesting and difficult place to be, but it's also a really interesting challenge that the answer to the crises, I firmly believe, as in housing and healthcare, are immigrants. We're in a very tight spot, but to get to that other spot is going to be successful because of the people that come in and provide those very key strategic work. And when you look in the construction industry, it's everyone from the engineers, project managers, down to laborers and tradespeople. Everyone in that sector needs to come in. And so how can we develop strategies, we work with people, we help them, network into the community. It's a very, kind of tactile kind of approach that we have. I think what we hear is that people want to stay and what will commit them to stay is...
Time for the Liberal questioning has elapsed. We'll now move on to the NDP with Ms. LeBlanc.
Thank you very much, Madam Chair, and thank you thus far for all of the answers. I do agree with my colleague that it is tricky to sort of drive at this system problem. Like we know that we lack housing, we lack education, or we lack capacity in education, we lack capacity in healthcare, and yet we want to bring lots of people in. And I of course, I totally 100% want to bring people in. I just want to make sure that they stay because they land well. And so I have a few questions about that, but I want to dig down a little bit more specifically on a couple of things that may have been already touched when I was late, before I got here. But one critical hurdle, and I have a few examples that I can talk about sort of around this, but is the issue with public health insurance. So because folks don't have insurance or they have to be here a year before they get an MSI card, it leaves a significant group of people unable to access healthcare. And I understand that for certain people, they when they are attached to a job, the employer then pays for private medical insurance for a certain amount of time. I know that happens with temporary foreign workers, but my understanding is the insurance is actually not that good, and there's like $100,000 max on it, which, if you have a serious illness while you're here, then that's a big issue. People who have not yet been granted permanent residency, babies in Nova Scotia born to parents who are not eligible for MSI, children and spouses of people who have been granted refugee status but who themselves were excluded, and temporary foreign workers. So, direct question, is the department working with the Department of Health to expand access to MSI?
Ms. Lesperance?
Thank you for the question. So again, we do economic programs. So the programs that we have at Immigration and Population Growth are people to come and stay in Nova Scotia for the long term. When they apply to our office, they most of the time have a job offer, and they are supported with their employer, and we can provide a letter of support for a work permit as well as a nomination for permanent residence. The letter of support for the work permit will get them a work permit that is at least a year in duration, normally 2 years, as long as their passport is also at least 2 years out. If your work permit is at least a year in duration, you would get, this is my understanding of a system that is not ours, but my understanding is that you would get access to MSI upon landing. I believe that the people who are not eligible for MSI would be the people who do not have work permits that are at least a year in duration. So those would be temporary foreign workers mainly, and so employers that would be supporting temporary foreign workers would have that in their plan in terms of attracting them and using that federal temporary foreign worker program.
Ms. LeBlanc?
Thanks for that. So recognizing you are the department that does the whatever you just said, the work programs. This is the thing that we come up against at public accounts all the time, is that, we're the department that does this, and they're the, and everyone talks about how they don't want to be siloed, and all the deputy ministers are meeting with each other and all of that. And yet, it seems strange that if we're trying to attract 25,000 people a year, that we wouldn't have a table of the Deputy Minister of Education, the Deputy Minister of Labor Skills and Immigration, Deputy Minister of Health, where people are going, okay, what do we do? How do we work together so that this particular person, so it's person-centered, has all of the things that they need? That being said, in that, if someone gets a work permit for a year, does that mean their family is covered as well under MSI, or is it just the worker?
Ms. L'Esperance?
It would be accessible for the full family, yes.
Okay. Ms. LeBlanc? Thank you.
It seems to me that that's helpful, but there are people falling through the cracks. I will give an example of someone who came into my office the other day, and she was a temporary foreign worker, but yet we have no way of supporting her as she goes through a medical crisis. She's been let go from her job that she was brought here to do, therefore has no medical coverage. Because she was let go because she was sick. She became sick while she was here. And so she, has a choice of paying, hundreds of thousands of dollars for medical treatment in Canada, or going back to her home country where she will also pay hundreds of thousands of dollars for medical treatment, or just never get the treatment she needs because she can't do that. So, if this is the signal we're sending to folks, it doesn't feel super welcoming, right? So can we address that issue? I wanted to ask about building welcoming communities, and this is again this is part of it. So I will say that in my community, often people come in who are European descent, who have lots of, who carry myths with them about newcomers. That newcomers, they get their rent paid for. That newcomers are taking all the jobs. I know you know these these myths. What work is the department doing, and maybe ISANS as well, to prevent those myths from taking hold before people are welcomed into a community? Like, is there a scenario where I can invite ISANS to Dartmouth North to do a workshop or whatever? Like, how does that work?
Ms. Watts?
Absolutely. We'd love to come. And we receive funding both from IPG, but also from other funders as well, to do a series of different types of workshops. So they would include the Welcome Ambassadors program, which is kind of works with community people to help them develop the strength and skills to be able to work in their own local communities to take on a project. We have intercultural workshops, which are delivered in a variety of different ways on different topics tailored to the need of the community or the workplace. We also have a very active team that works with employers and talks about building, workplace culture in the workplace so that people are addressing and feeling more comfortable and engaging in discussions. So we have a variety of different programs tailored to different to groups and needs, and we're very happy to be involved in that. We also, through work with a variety of partners, have developed a positive messaging campaign. So getting out beforehand, we're not waiting for an issue to come up in the community, but positive messaging about immigration in a very key way. So we have a very strong communication team that does a lot of social media work around explaining immigration, the numbers. And also we take on our work, we take very seriously our commitment and work with the Indigenous community around reconciliation and understanding that the majority of us are immigrants. We may have forgotten our story about being immigrants, but the majority of us are immigrants, and we need to understand our own place within that. And I think that's that whole opening up and understanding of culture, of understanding and respecting across the breadths of our whole community is going to help build that. And again, that's not the lift of any one group. That is a whole society lift in terms of really responding about what does it mean to have a sense of belonging and really working to respect that diversity and supporting inclusion. So we're very, very interested in connecting.
Ms. LeBlanc, you have 15 seconds.
Oh, my gosh. Well, the CCPA put out a report in 2021 that sort of refutes all of the things you were saying when you were answering questions of the Conservative, PC Conservatives, PC Caucus.
Order. Time for NDP questioning has elapsed. Now over to the PC Caucus with Mr. Palmer.
Thank you very much. Just a quick general question. The Auditor General's indicated that it's been very, the collection of the report and getting that together, that it was good collaboration and working relationship with the department. And it's been over a year now since the work began on some of those recommendations. Just maybe highlight 2 or 3 changes or the progress that's been made within your department in pertaining to those recommendations. Maybe top 2 or 3 snapshot. Maybe what you learned from that would be helpful.
Deputy Czapalay?
Yeah, yes, thanks. I'll start, and maybe Jen Lesperance can add to my response. But we always strive to have a good working relationship with the Auditor General staff when they work with our department. I believe this audit was more than 2 years. I was joking with the Auditor General, half joking, that we were going to recruit some of our staff. They know our operation well. So it's a collaborative effort. We want to assist them in getting what they need to do a comprehensive audit, and we also want to comply with their recommendations to the fullest of our ability, and we see the whole process as strengthening our branch at a time when it needs strengthening, because we are growing rapidly, and if we're to achieve the 2 million by 2060, we need a solid infrastructure behind that growth. And so I just wanted to add that as a preliminary, and then maybe ask Jen to talk about the specifics in terms of some immediate implementation.
Ms. Lesperance?
Sure. Thank you for the question. I do want to echo that we did look at this as a fantastic opportunity to strengthen as we grow. We have been a really great group of staff there's a lot of peer support amongst our staff and peer training, but as we grow, you can't lean on that as much as we used to, and we really need that infrastructure behind it to ensure that as new people come on, there's consistency among the process. So that is something that we've absolutely begun as we grow our staff. Another great example is we have just released our call for proposals for our next settlement round of funding, and the way that we will administer that call for proposals is very different than the way that we have administered in the past. For example, we will have a conflict of interest that is sort of a third line of signing for anyone who's on the review committee to ensure that there's no conflict of anyone reviewing those proposals that come in. There was previous government conflict of interest, but knowing the sensitive information that we deal with, it's again just one heightened piece of awareness. As of today, there's currently an anonymous fraud reporting system that has, you can find that on our website, and anyone can go onto that and report any fraud that they might be aware of in the provincial immigration system, anyone who's falsifying documents or taking payment for jobs. We want to know, because we need to counteract that in any way we can. So that ability to do that anonymously is now in place because of the work of the Auditor General. We've also recently completed fraud training with all of our staff. So previously that might have been for our programs division or for the investigations and compliance unit, but there's been a recognition that from the person who is our receptionist to myself, we all need that fraud awareness training, and that is now being completed across the board. Those policies that we need to sort of link them all together, and the documentation and the full training plan, it's going to take some time because we really want to make sure we get it done right, but the individual pieces have really begun as of today.
Mr. Palmer?
Thank you very much, and I will now pass it on to my colleague, Mr. Taggart.
Mr. Taggart?
Thank you, Chair. I just want to say how much this has been a really interesting, informative discussion here. I'm particularly happy, really, to hear the results in rural Nova Scotia. Sometimes they aren't seen as, they're not as obvious. But the question that's come to my mind, mostly sitting here listening to this and learning, is so there's been lots of questions with legitimate concerns, that may or may not be created by immigration. But I guess I just want to ask, and whoever's the right person, where would we be 10 years from now? Where would we be? I understand there's lots of challenges today, but where would we be 10 years from now if we were not doing what we're doing today to try and increase the population in Nova Scotia? Thank you.
Deputy Czapalay, 4 minutes.
So thanks for that. I might end up taking all 4 minutes. No, just we know that in Nova Scotia, our natural population, the death rate is higher than the birth rate. Okay, so if we did nothing, our population would shrink for sure. Also, we need to work hard to ensure that all youth who live here see a future here. And that future is through connecting to employment and having thriving communities. And so we see that ensuring that youth are connected to training and to education opportunities and see job opportunities here at home, that's really important. Statistics Canada came out with their official report. It's every July. And what they showed year on year is from last July to this July, our population grew by 28,860 people. I'm fond of saying the staff told me not to say this, but that's a Sydney, not the greater Sydney, it's a Sydney. So when you think of that, we have added that capacity. In a normal year, if we did absolutely nothing, population would decrease. Instead, with all of our collective efforts, and I mean everyone in the room, our population increased by 28,860. In addition to that, we lowered the median age of Nova Scotians. And the we have the actual number, but that's unheard of. And Statistics Canada called it a dramatic decrease. It was sort of within a 1 point, but we lowered it from something like 44.6 to 44.1 or something. So our population is no longer aging. So those two things combined are what give me hope that there's a future for everyone here in Nova Scotia. And the communities, I know them well. Mum's in Parsbro, and I grew up in Barrington Passage. I know rural Nova Scotia, and I know what those communities are doing to try and survive, and they need newcomers. They're not short of entrepreneurial ideas. They're not short of the grit that it takes to carve out a living in rural Nova Scotia, but they need newcomers to add to that population base. So I see that the richness of our rural population and our rural communities will only benefit from increased population growth.
Mr. Taggart?
Thank you, and very much. And before I pass over to MLA Melissa Richard, sorry, I just want to make this comment that as my children grew up, we fought to keep our school open, declining enrollment every year. The last 2 years in that little junior high in Bass River have increased enrollment like 20%. I just think that's amazing. Sorry, thanks for the time. Melissa.
Okay. Ms. Sheehy-Richard, you have less than 1 minute.
Again, I always look forward to when your department comes because I can feel the passion in your work. So I'm probably just going to comment. I don't know. I'm excited to hear a little bit more about bridging gaps and the numbers that we're seeing in them and moving forward. And maybe a presentation to my community would be something too that piqued my interest. But again, I thank you because it's just so positive, and the fact that we're 2 years post and you've already made some incredible improvements and willing to work towards the rest of them is happy to hear. And we learned to give some credit where credit is due, and thank you for that good work.
And 5 seconds. Anybody want to answer? Thanks, Deputy Czapalay. Okay, the time for questioning has elapsed. I want to thank our witnesses for coming here today. Do you have any closing remarks? Deputy Czapalay? I
just want to thank the committee for keeping a sharp lens on this important topic. we've been here before on population growth and immigration, and I just want to assure the committee that we appreciate the complexity of population growth and immigration and the need to proceed with care and proceed with collaboration, not only across government and all levels of government, but with our settlement providers, with our community partners, to ensure that people not only come to Nova Scotia, but they stay here. And I really like what MLA LeBlanc said in terms of landing well. We want people to land well. And so I thank you for your interest, and I feel your support, so thanks very much.
Thank you. Ms. Watts, did you have any final remarks?
Yes, I think just to say two things. One thing that I did not highlight was the innovative programming around pre-arrival support. There's both supported federally as well as provincially, which makes a huge difference. People arrive here better prepared and more able to do that. So that's a huge component to our programming as well. And I think I'd just like to end by saying that we have a huge gift in this province, and it's the people who are the staff people in the settlement community across this province. So everyone that works in a settlement agency day in and day out responsive to the needs, especially the humanitarian crises that we've responded to and continue to do, have been incredibly beneficial, supportive, often to our immigrants, often our refugees themselves, that really give a tremendous amount to making this a welcoming community. So I just wanted to make sure that that is highlighted to this group about their incredible work and contribution. Thank you.
Thank you very much. Our witnesses are free to go. The committee is now going to move on to committee business, and I would like to move on to, first of all, just getting the correspondence out of the way, and then we can move on to the subcommittee. We did receive a letter on November 25th that resulted from our last meeting, where we had a number of questions that weren't answered, and I just want to make sure that these are reflected in the record of this committee, because often we do get correspondence back and we don't sort of deal with it a whole lot more. So I'm just going to quickly summarize what was in the letter. Question 1, the average wait time for a child at the IWK emergency room to be seen. And the answer back was average wait time to be seen by a physician at the IWK emergency department was 338 minutes. And by my reckoning, that's 5.63 hours. The average wait time for emergency rooms across Nova Scotia, there's an appendix which I'm not going to summarize because it's big and long, but I do note the general trend that is increasing. If we looked at question 3, in the last month, how many hours were ERs closed across Nova Scotia? I do appreciate that we had a quick timeline for return. The attachment does not refer to the most recent month. It's from last fiscal, so I will actually request that. We'll give them more time to answer that one, but we would like to know what that is. Notices of overcapacities that have come to the public for emergency rooms over the last month. There was one notice, and the link is included. How many notices have been put out encouraging people not to visit emergency rooms because of being overstretched or understaffed? That does not, that's not answered. It just indicates the purpose of the message is to advise of longer than wait time. So that question was not answered. When was this season's flu vaccine first made available? Indicates on October 22nd that happened. Deputy Lagacé was following up with respect to the sufficiency of COVID child booster appointments. As of November 23rd, there were 500 appointments available for children aged 5 to 11 in the HRM area, and new appointments are being added to Can Immunize, and they recommend people check every few days for new appointments in their area. Question 8, provide the updated figure on what we're spending with Maple. Question was whether it had been, whether it was still $500,000 or was there more, and indicates there are 2 separate contracts with Maple providing virtual health services, and that was Nova Scotians on the Need of Family Practice Registry get free online medical appointments, and that contract with Maple is $2 million per year, and Virtual Emergency NS is a virtual care option delivered by emergency department physicians, and the overall budget for virtual emergency Nova Scotia is $1.25 million for this year. Then we move on to question 9. What is the average cost of an ER visit using Maple? And is the department able to provide a cost comparison between an in-person appointment at an ER and a virtual care emergency? It says we do not have per visit cost associated with virtual emergency NS so far. And it indicates there will be evaluation, so we may just ask for that evaluation when it is completed, since that was really what the question was about. Updates on the interest in incentives for emergency room physicians. It says there are no incentives exclusively for the recruitment of ED physicians, nurses, and nurse practitioners. Nova Scotia does provide incentives for doctors who commit to working in rural parts of the province for 5 years. And the new primary care physician incentive program encourages doctors to establish a family practice in rural communities and indicates that doctors can earn up to $125,000 in incentives, $25,000 when they sign the agreement to provide a service in a rural community, and $20,000 per year for the next 5 years. Are there any new recruited physicians working in emergency rooms now? It indicates that from April 1st, 2021 to March 31st, 2022, there were 19 new physicians for emergency medicine. And since April, there have been 4 new physicians for emergency medicine. And notes that some physicians do emergency work part-time. How many unvaccinated healthcare workers are not working right now? That's question number 12. At Nova Scotia Health, 127 permanent employees in the nursing, healthcare, and support staff categories are on unpaid administrative leave due to incomplete or unreported vaccination status. At the IWK, 7 permanent employees are on unpaid administrative leave due to incomplete or unreported vaccination status. How many spring 2022 nursing graduates have been offered and accepted a job in the province? It indicates Nova Scotia Health has hired 344 graduate RN students, 117 graduate LPN students through the formal graduate intake since December 2021. The majority of hires were in permanent full-time positions, and had 245 spring 2022 grads apply to work with Nova Scotia Health. 163 were hired into supernumerary positions in Central Zone 79, Eastern 37, Northern 25, Western 18. They hired 37 to core vacancies, 36 declined offers, 12 accepted positions with the IWK, 5 relocated out of province, and 9 applicants did not return calls or emails. And it goes on. Ms. Coombs?
Yes, I just have a question, and it just, it says 163 and then 37. Is that 163 total with the 37, do we know? Or is that separate?
I don't know, and we could actually inquire back about that.
It's more just a question on.
Yeah, okay.
I'm just curious.
Mr. McGuire?
So I just have a couple of questions here because a lot of these questions weren't answered in full detail. So I just wonder if we can, as a committee, can reach back out to them. We need more detail on emergency rooms across Nova Scotia, and just saying that it varies. If we could get what the questions I had asked when they said it varied was, how much was it this month? How much was it last month? How much was it for the year? So if we could get specific times for the last month, last couple of months in particular, that'd be great, because that was the question that I asked for question number 2, and that this answer does not answer the question that was put forward. It was the same thing they said to us that day. The question number 4 and question number 5 is actually, I don't know if it's incomplete or it's purposely not being. What I had said was how many notices had gone out telling people that there will be longer than usual wait times, and that was not answered here. And they said there was 1, and that's frankly not true. Just a quick Twitter search will show you that that's not true.
So I think that there's probably a difference of, I think they probably understood a formal notice of overcapacity as a news release coming from health or the health authority or whatever versus something that goes out on Twitter.
Well,
So I do think, they did say there's one notice, but question 5, I think you got to the nub of it there,
Yeah.
and we didn't get an answer there. So
Right.
I do agree that we need to have more information
So
on
that's-
that. I will just remind the committee, we asked for a very quick turnaround on this, and so we may not have gotten as fulsome an answer as we might have expected. So I do think it's appropriate to
So we do
just
some follow-up.
follow back and to make sure that they're given appropriate time to, because I can certainly understand, they gave us, for example, the emergency room closures, the number of hours for the last fiscal, but they didn't have the most recent month.
Right, and so then I had
Mr. McGuire?
question number 13. The actual question wasn't how many people did you hire. That it was more detailed than that. It was how many graduated and how many of those graduating class was hired. So I would ask that we follow up on that and find out how many individuals graduated in 2021 and how many of those individuals stayed in Nova Scotia. And the response was they didn't know. So that they should have the answer to how many individuals graduated across Nova Scotia for nursing. So I asked that we follow up on them for that. And also the virtual wait time, or virtual care. Part of that was we asked what the wait time was for those calling into virtual care, and how many of those individuals are told have been given the advice to go to emergency room. And that question wasn't answered either. So I asked that we follow up with that on the wait time for virtual care, because I think it's very important. We're paying a company to do virtual care, and I think it's very important that we find out what the wait times are for virtual care and how many of those individuals that are calling into virtual care are being sent to an emergency room or a walk-in clinic. And that was part of the question, and it wasn't answered here.
So I will just say that when the clerk and I work on these letters that go back, the clerk goes back and listens to what was said exactly. So we'll take a listen to what was said exactly before we go and respond back and ask for a little clarity on some of this.
Thank you.
Mr. Young?
I just want to add, as this just came out really, and I'm not able to click hyperlinks that are on this page. I just asked for more time to review before we make any decisions about additional questions or, this is new, right?
It was sent to, out in our correspondence, yes?
Yes, and it was sent on Friday.
It was sent on Friday because we asked for it to come back on Friday. So it did come on Friday, and the hyperlinks would be there.
5 days.
Right? So I will just say that. Ms. LeBlanc?
Well, thanks. I just wanted to say I appreciate you, Madam Chair, requesting this information in such a deliberate and sort of, I don't want to say strict way, but, you said what we wanted and we got it. And I think that that's really helpful. I mean, obviously, I think it's more helpful when witnesses are prepared to answer detailed questions. But I just wanted to say I appreciate that you asked for this information quickly and we got it quickly. And there will be, more to do and more to sort of digest in it. But I think it's a really good start, and I appreciate it.
Thank you. Mr. Smith?
Thank you, Madam Chair. I would just say in response to my colleague and friend from Halifax Atlantic that it seems like question 2 is answered in the appendix. His appendix has all of the ERs and all the wait times for the last 4 years. So I'm not sure what additional information we would be looking for as it goes year over year over year.
The question was for the last month, not for the last number of years. And so
it does have fiscal year 2023. And I'd also contest that question 5 is answered to the best of their ability. The question is, how many notice has been put out to encouraging people not to visit the emergency room? And the answer is, please don't hesitate to visit, but it might be, you might experience a longer than expected
So we're
wait
asking
time.
how many of those were sent out, though?
Yeah,
And
and
the
we
answer
did.
1 in question 4.
our information is that in fact, there have been numerous alerts that have gone out. So
I think they misunderstood the question.
I would agree. I would agree. So I would say in the health authority's defense, they looked at how many news releases had gone out. However, we do know that there would have been alerts that went out over Twitter, that kind of thing. So that was not included there. So it's an incomplete answer. We were asking for the number of times. Communities have been told we're over capacity, et cetera, and we know it's more than one. So we do need that information. So the letter went out on 4/18 on Friday, so that was a number of days ago. I do think we have had time to digest that. So I will prepare a letter to get back to them for the rest of that information. If we look at the November 28th letter, this was in response to MLA LeBlanc, and she had asked for some information regarding budget planning from Nova Scotia Health Authority, and she said, yeah, I can see. Yeah. I would not be able to speak to a government department's budget planning or resource allocation. So I think the letter went to Nova Scotia Health, but it was about an education issue. So I think Ms. Oldfield wouldn't have been able to speak to that. So I could be wrong, and if there's further follow-up, please do raise it with me. Okay. Mr. Young.
I was just going to say, Madam Chair, with the utmost respect, in looking at time, could we move back to the agenda sequentially as presented, please?
Absolutely. I think we're done here, so we'll move on. And Subcommittee on Agenda and Procedures, record of decision. We had the subcommittee met and did discuss the potential topics for future meetings. Sorry. Members have been provided with the record of decision from this meeting, and I'd like to open the floor for discussion.
Yep. 5-minute discussion.
Mr. Young?
With respect to that, I move that the committee adopt the topics and corresponding witnesses selected by the subcommittee on the 23rd day of November 2022 for upcoming Public Accounts Committee meetings.
Ms. LeBlanc?
I just wanted to clarify, did we not say we were going to take actual names of people out so that in case those positions had changed? I can't remember what we decided there.
I thought it was just for the metropolitan regional.
I can't hear you.
I think that's in general because there's so much movement right now. Okay. So I do believe Ms. LeBlanc is right, okay, that we needed to do that. So yeah, we did do that in some places and we didn't in others. Mr. Smith?
Just so for clarity, then we'll just keep all the titles the same and omit the person's name.
Yeah. I think that makes sense. So with that one change, Mr. McGuire. You don't have to second the motion. Is there any further discussion? Is there any further discussion?
I just saw that.
All those in favor of the motion, say aye. Contrary-minded, nay. And a round of kumbaya right now. Okay. The other matter, I believe we are deferring to another day. So with that, any further discussion on anything? No. All right. With that, the meeting is, I should let you know when our next meeting is. There we are. It is December 7th. In camera, it's with the Office of Auditor General, read the 2022 financial report. And if there's no further business, I now adjourn the meeting. Thank you.